Hey everybody, Dr. Jeff Wienke here from Capital Foot and Ankle, and today I wanted to take some time and talk to you guys about diabetes. You may be wondering why a foot doctor is talking to you about diabetes. The reason is that the majority of the problems that I see in my practice are caused by diabetes. If you take a look nationally, even worldwide, you'll see that the incidence of diabetes continues to go up and up and up. The age of onset or the age of diagnosis continues to get lower and lower and lower. So this problem with diabetes continues to grow and continues to cause widespread medical problems, but particularly with the feet. Now when patients have diabetes and they have high blood sugars and they're struggling with control, it affects the feet several ways. Number one, it'll affect the blood flow to the feet. So the blood doesn't travel through the arteries as well as it should, and we have trouble healing either after trauma or surgery or developing an open sore. The other problem caused by diabetes is that the nerves don't work the way they're supposed to. And the first nerves that are affected are typically those in the toes and then the feet and leg. And this is often referred to as peripheral neuropathy. When patients develop peripheral neuropathy, they're unable to sense problems with their feet. So if their shoe is rubbing or they're developing calluses or blisters, unfortunately they're just not able to sense that. A patient with feeling would notice that right away and stop and check their shoe, but once you develop neuropathy, unfortunately you don't have that warning sign. So patients with peripheral neuropathy are already at a 12 times higher risk of a leg amputation compared to somebody without diabetes. And again, that's typically because they'll develop an open ulcer, those things get infected, and that's where we have all of our complications. Once you develop a foot ulcer, the studies show that the 10-year mortality rate is 70%, and even the 5-year mortality rate is right around 50%, which is more than prostate cancer, breast cancer, and Hodgkin's lymphoma combined. So it's a serious issue. Every 30 seconds, someone in the world loses a leg to diabetes. So diabetes plus peripheral neuropathy, and particularly plus the addition of a foot ulcer, dramatically increase your risk of leg amputation and ultimately a premature death. And so it's so important that we catch these things early, that we treat them aggressively and get those ulcers healed as quickly as possible. As far as prevention, what can we do? Well, number one, if you have diabetes and peripheral neuropathy, it's important to check your feet every day. I like to have my patients apply lotion to their feet. That way they're rubbing their hands over the foot and they'll be able to feel if there's some new callus, blister, open sore, cut, those kind of things. It also works well to have a spouse or family member or friend check your feet. If you can't reach, I like to have patients put a mirror on the floor so they can look down and inspect their feet in the restroom if they can't get their hands on them. Number two, if you've got peripheral neuropathy and diabetes, most insurance companies are going to cover diabetic, custom-made shoes and inserts. Now, studies showed custom diabetic shoe gear will lower your risk of amputation by as much as 20%. And so if you have questions about diabetic shoes, it's important to get in and see a podiatrist right away. Number three, before you put those diabetic shoes on, it's important to shake those shoes out or put your hand inside of them and make sure there's nothing in there, rocks or thumbtacks or insulin needles, nothing that could cause rubbing or sores. Also, it's a great idea to wear diabetic socks. Those typically won't have any seams, so there's nothing that can rub or cause any new ulcers or areas of pressure or friction. And finally, it's important to have your feet checked regularly. Depending on exactly what's going on, the American Diabetic Association recommends anywhere from a once a month checkup to a once a year checkup. So if you're at relatively low risk and your primary care doctor is checking your feet at all of your visits, then that's great. However, the higher the risk, the more frequent you need to have your feet evaluated and the more specialized care you'll require. So if you have questions or want to schedule an appointment, you can call us at 402-483-4485. You can find us on Instagram and Facebook, or you can check us out online at capfootandankle.com.